Thank you for having me. I'm very happy to be here to speak with you and hopefully during the discussion to be able to hear from you and learn a bit about your ideas and some information specifically on privatization in Alberta, which is something that Parkland Institute will be looking into in the next year to two. So as Sandra said, my name is Ian. I started at Parkland about 8 months ago. I came here from York University in Toronto, where I'm completing my PhD in sociology. And my master's is from the University of Victoria, also in sociology. So I am a sociologist by trade. And I'm going to be speaking to you about the sustainability of Medicare. And the presentation, I should say, the video will be posted online. Hopefully the PowerPoint will also be posted by midweek. And I've already started to write a blog post based on the research I did that I'm presenting to you today. So what I'm going to do in the presentation is I'm going to start with current affairs. And I've got a quote from the speech from the throne. If you didn't have a chance to view it or read it, a quote specifically from Premier Notley, and one rebuttal from the Calgary Herald's editorial board that came out on Wednesday in their editorial. Then I want to go over the historical details of Alberta's healthcare system and provide a number of charts as visuals so you can view the level of spending we've had in Alberta for public and some visuals on private healthcare as well. I want to talk, because I'm a sociologist, I want to look at kind of larger political and economic issues, and specifically public revenue in Alberta. And many of you are probably aware, because of the changes to our personal income tax and corporate tax structures about 15 years ago, and the fact that we have low resource royalties, effectively the provincial Tories were actually starving the government of the revenue it needs to actually provide quality public services such as Medicare. Then I have a really nice table that compares the funding of public and private healthcare across the Canadian provinces, and some surprising numbers, or surprising to me, as to the level of privatization within Alberta in comparison to the other Canadian provinces and territories. I want to talk then a bit about the defrayed costs for our infrastructure and the very worrying fact that we have a number of infrastructure projects specifically to healthcare that are going to need to be developed over the next number of years that we should start to think about today. Then I'm going to end the presentation by talking about what sociologists call the social determinants of health. So how the actual structure of our society affects people's level of health and their ability to access healthcare. So just to start, this is a quote from early on in the speech from the throne where the Premier is saying that her government is going to support stable and predictable funding for our health system. They support a universal, accessible, high-quality health care in our province. She also mentions long-term care and home care, which are themes that we've heard a number of times this morning. And a little bit later in the speech, she talks about the fact that hospitals are going to need to be built and renovated in the next number of years. So overall, a very positive attitude towards public health care in Alberta coming from the Premier's office. Now, the speech from the throne was Monday. Wednesday, the Calgary Herald editorial board wrote an editorial. I'm not going to read this long quote to you, but they say, well, it's great that the provincial finances are going to be reviewed. The Calgary Herald's editorial boards feel specifically that our spending on healthcare should be reviewed, and for them, they're arguing that our healthcare costs are ballooning and are arguably unsustainable. And in this longer quote, they're saying that from 1980 up until 2014, healthcare has taken a larger chunk of the provincial budget over that 35-year period. And so they're mobilizing an argument that that's because healthcare costs have ballooned out of control and have pinched funding that could go to other programs such as education or human services. I'm actually going to counter that argument in my presentation and say, actually, what's happened is other programs, their funding has been cut substantially, and healthcare actually hasn't been ballooning out of control. It's taken a larger part of the budget because the budget for other services has actually gone down dramatically. So first of all, I want to start just with a couple points on the early history of Medicare. As someone who was going through the Parkland archive on our research to do with healthcare, I learned quite a bit, and I thought I would share some of these quick dates and stats with you. So if you're not aware, Albertans and Canadians voted to have universal Medicare in the 1960s, and throughout the 60s and 70s, eventually the system developed and solidified into a national healthcare system. The reason why Albertans and Canadians voted for universal Medicare is because the previous privatized system, the costs were actually rising substantially. And it was the view of the majority of citizens at the time that the best way to rein in costs was actually to make the system public and universal. Essentially, they wanted to bulk buy services to get an economy of scale. By contrast, their neighbors to the south in the US didn't go the route of universal Medicare. And what's ended up happening over the last 4 or 5 decades is healthcare in the US is now about twice the cost it is per capita to Canadian healthcare. So what we've seen in comparison to the US is through a privatized system, it actually costs more per person to deliver medical services. And finally, one thing I'm going to hit on quite a number of times today is Alberta's healthcare costs in comparison to the size of our overall economy, or our gross domestic product, as economists call it, or GDP, is substantially low. So in comparison to a number of jurisdictions around the world, and especially to other Canadian provinces, we actually spend relatively little on public healthcare. So I'm going to run through a number of visuals for you because I find condensing numbers and statistics into charts helps you actually get a better understanding of historical economic trends. And so this one is looking at overall program spending during the Premier Getty's years in the mid-80s to the early 90s. And so the title says, since 1985 to 86, this is an average of provincial expenditure for public programs up until Ralph Klein becomes Premier in 1992. And so what this chart shows is Alberta actually spent relatively little in comparison to the other provinces. We're all the way over on the right there, 2.3%. The next smallest expenditure on overall public programs is Saskatchewan at almost double our expenditure at about 4%. And actually, when you take inflation and population growth into account, what this chart shows is from 1985 until 92, 93, our public program expenditure actually went down. So not only did we not keep pace with the growth of the other provinces, we actually reduced our public expenditure. Yes?
And is this specific to healthcare program expenditure?
No, this is
program expenditure generally.
Right. This is overall program expenditure.
Okay.
So overall, our spending on public programs went down from 1985 to 1992, 93.
Well, this is growth, though, right? So it's still
It's still
Alberta still
growth.
grew by 2.3.
Right, it did. What I'm saying is when we take population growth and inflation into account, we actually saw a slight decline overall in our public expenditure.
Okay. Yeah.
So this is overall public expenditure. Now this next chart is healthcare versus other programs. And this is where I start to mobilize my argument against what the Calgary Herald editorial board said, where healthcare is taking a larger chunk of the budget. This sort of trend within our province actually started in the mid-1980s and continued on for a number of decades. And these two charts, the one I just shown and this one, are from Kevin Taft's book, Shredding the Public Interest, which was released in 1997 as Parkland's first publication. It ended up becoming a national bestseller. So what this chart shows is healthcare essentially stayed even from 1985 all the way through Getty's reign into 92, 93. And other programs, Premier Getty's government reduced their spending substantially. And so what the effect of this overall in the provincial ledger is that healthcare becomes a larger chunk of our overall provincial budget. So this gets us into the Ralph Klein years. And Ralph Klein, as I'm sure most of you are aware, was premier from 1992 until 2006. And so over that time, Ralph Klein reduced the overall size of our public sector by 45%. So when he became premier in 1992, our public sector represented 22% of our overall provincial economy, and it was reduced to 12% of our provincial economy. So that's a reduction of 45%. Also, around the turn of the millennium, as many of us are aware, corporate income tax for large corporations was reduced by about 35%, from 15.5% down to 10% that we're currently at, and the current government is going to raise that back up to 12%. So not even getting us back to half of the cuts that were made during the Klein era. Also, personal income tax was turned into a flat tax system. So previously we had a progressive income tax system, which most jurisdictions in the world have. Currently we are the only jurisdiction that has a flat tax system, or I should say Premier Prentice was starting to move out of that, and now the Notley government is implementing a progressive income tax again for the top 10% of income earners, which is people making $125,000 or more in Alberta. Previously, we actually, for people who are making $40,000 to $100,000, they actually would have been paying less tax than they currently are at the 10% rate. Our resource royalties as well were maintained at a very low level during Premier Klein's era, and that has continued on to this day. And why I bring these things up is all of these things are part of the reduction in overall revenue the province had and continues to have a very low level of revenue in comparison to our overall economy. And so in fact, during Ralph Klein's 15-year reign as the premier, he actually increased healthcare spending slightly over that 15-year period, but healthcare actually became a smaller part of our overall economy, going from 4.45% of our gross domestic product in 1990 to less than 4% in 2006. And so healthcare didn't grow during the boom years of the oil boom in the early 2000s. Unlike our overall economy, which obviously was doing quite well. This is what I was talking about, the effects of the flat tax. These first rows that are going up show that people in low to medium income actually are now paying more because of the flat tax and have been for over a decade. And people on the far right there are people who make a substantial amount of money, $75,000 and above, actually had their tax reduced. And this sort of effect on individual tax filers is going to come up later in the presentation when I talk about the social determinants of health. This chart here is on our healthcare as a percentage of GDP, or gross domestic product, our overall size of our economy. And what you can see here is starting in 1989 and going through 2007, and this has continued on to this day, healthcare spending as a percentage of our overall economy has actually gone down and has remained steadily low. throughout the last 25 years. So this is part of my argument that I'm mobilizing, that healthcare is actually sustainable in the sense that we can afford it. We have a lot of money here, not only public money, but also in our overall economy, which means that we can more than afford to maintain our current level of spending on public health care and actually increase it if we chose to do so. So this is getting into some of the Ralph Klein cuts that he made specifically to healthcare. As many of you might be aware, from 1994 to 1996, Ralph Klein cut healthcare by 21%. So one of every $5 that went to healthcare previously was taken away by the Klein government. These cuts were so large that we had a peak in healthcare spending in 1993, and we didn't surpass that peak again until 2001. So we effectively lost 8 years of opportunity to maintain or increase our spending on public healthcare. Another really disturbing trend that I found in my research was our healthcare spending as a proportion of our overall healthcare spending went down substantially from the mid-1970s to 2009, which is the latest stat I have. And so in 1975, during the Lockheed days, we actually went through quite a number of years of building hospitals and other healthcare facilities. And we actually haven't maintained that infrastructure and haven't built a lot of new infrastructure since the Lockheed days. And what that's meant is by 2009, we're only spending about a quarter of our overall healthcare spending on healthcare infrastructure projects. And yeah, so our healthcare by 2009, our healthcare spending on hospitals had yet to surpass the spending that we used to have decades previously. Another interesting thing about the supposed unsustainability of our healthcare system is from 1997 to 2007, which are the last 10 years that Premier Klein was in power, total healthcare spending, so that's private and public, actually increased substantially. However, most of that increase had to do with prescription drug costs. And the reason for that is Prime Minister Mulroney brought in a new patent protection law, which meant that patented drugs had, instead of a 7-year patent protection, now had 20 years, which meant that important drugs, pharmaceutical drugs, that we need in our healthcare system ended up costing us much more because we could only get it from a single pharmaceutical provider. And during the same period, 1997 to 2006, public healthcare costs didn't increase substantially. So the overall cost had to do with prescription drugs and private costs. And this is a chart, it's a bit fuzzy, sorry about that. But this is a chart that shows you what I was just talking about. So total healthcare on the top there, you can see, has actually gone up quite a bit. But this line here is for hospital costs, and you can actually see around 97, 98, it just tanks. And never actually gets back to 2007, and never gets back to that level of 1997. And other medical costs, preventative care costs also go down during this period of 1997 to 2007. Obviously, in our research in the next year or so, Parkland would hope to update some of these stats for you, but I was just going through our archive and pulling out some of these visuals for you. Now, I don't know how well you're able to read this from your seats, but this table is on healthcare privatization. And there's a couple things I want to highlight about this, and if you want to go back to it when the presentation is put online, certainly you can view it in more detail. But this is the Alberta line here, and we see that we actually spent per capita, in 2007 I should say, we actually spent per capita more than the other provinces. So our line item is about 5,400, the Manitoba line item is about 5,250, and Ontario is spending about 5,000 per capita. So we're spending about $400 more per capita during at this time than Ontario. However, what's important to note is our economy is so large that this is the percentage of GDP that our healthcare costs are a part of. And we spend, by a large margin, the least on healthcare when you look at our overall economy. And so again, this is part of the argument I'm mobilizing that healthcare is sustainable, public healthcare is sustainable because we can afford it. We're actually spending significantly less than the next province would be Saskatchewan at 10.6%, and we're at 7.3%. As you can see, Quebec and Ontario are 10.9% and 11.3%, so they're almost 50% more than we are when you take the overall picture of the size of our provincial economies in comparison. One other thing I want to note here is on the far right, you look at the percentage of our healthcare in 2007 that was public, and actually in Alberta, we were at 74% public, and that means we're 26% private. And what's really surprising to me is 74% public is actually not the worst, and it's about middle of the pack. And so we actually had more privatization than Saskatchewan and Manitoba, but we had less privatization than Ontario and Quebec. So that's kind of a counter to some of the mythology of privatization in our province, at least at this point in 2007. As I said earlier, we will be updating our research files on privatization specifically within the next year or two, so we'll be able to see over the last 7 years if privatization has been maintained at this level or if it has actually increased. Yes?
So Ian, that also is just public funds spent. It doesn't tell us about how much public funds was spent for for-profit operations, right?
Yeah, so for-profit operations is a good point. Also, what I can't get out of this particular table is, as some of you are aware, some public funds during this period were actually spent on private delivery. So public funds actually went to private clinics, and those clinics delivered services based on public funds, which is obviously something I think we can agree we would like to see phased out of Alberta healthcare. So exactly, some of these things, these more complicated issues aren't represented in this table and need to be updated as we do our research in the next year. Yeah?
This sort of relates to the previous slide, but the drug costs and hospital costs, to some extent a lot of the conditions we have now are treated in the community controlled by pharmaceuticals, whereas before, in generations past, people might have been treated in the hospital. So, I can sort of see somewhat of a trade-off between, your hospital costs might actually go down, your drug costs go up, and that makes complete sense. What might not make sense is that drug costs are private, or not totally, but a great proportion of those drug costs are private in the community, whereas the hospital costs are public.
Yeah, that's a good point. A little bit later in the presentation, I'm going to mention there is a national campaign now for a national pharmacare plan, which Sandra mentioned that issue earlier in the meeting. And there's a great website. I'll show you the URL later. I think it's pharmacare2020.ca, which has a lot of really good information on why we should move to a national pharmacare plan and what that would do for us. Yep.
Just a comment, really, Ian. I think in particular when it comes to seniors care, it's very difficult even to be able to determine what actually constitutes a healthcare expenditure and what constitutes a living expenditure. That there's such a fuzziness around many of those issues too, and it would be worth teasing out those things also.
Okay, that's a good idea. Okay, I'm just going to move on to the next slide. So this is from a series the Edmonton Journal did in late 2014. It called Condition Critical, I believe it's called. And it was a series of articles that was published by the Edmonton Journal. They did about 5 months of investigative journalism to produce these articles and produce these statistics for us. And so a couple of things they say that I find very disturbing are our hospitals, about a third of our hospitals are at least 40 years old. About 2/3 of our hospitals are at least 30 years old. And at that point, that type of infrastructure starts to need higher maintenance costs and more frequent maintenance than younger facilities. Also, it says in the top point there, Alberta actually has 97 hospitals, which proportionally is a lot compared to other provinces. And if you look at other jurisdictions around the world, we actually have a lot of hospitals for the number of people we have in this province. So that is a good thing, but it also means that we have higher maintenance costs, as well as, given the age of our hospitals, it means that we need to build new facilities in some of these communities where these hospitals exist. The unfortunate thing is, under the provincial Tories, they had a rating system that cost us about $1.5 million a year. However, the rating system, as the Edmonton Journal said, and is widely believed, was flawed, and it was also subject to substantial manipulation as to what ended up being rated in what way and what priority those facilities got, and how the priority list related to the rating system. And so right now, the kind of upper estimate on our maintenance costs is currently at $1 billion. If we were to do all the maintenance we needed to do on our healthcare facilities, it would cost the province $1 billion. Obviously, there's a number of facilities that need to be built beyond new general hospitals. Of course, there's the Calgary Cancer Centre that people have been advocating for a number of years. That hopefully will come into fruition in the next few years. And there's a number of other hospitals, including ones in Edmonton, that are in dire need of replacement. So my humble suggestion is that our new government needs to actually have an honest infrastructure rating system to actually evaluate our infrastructure on an ongoing basis. And we need a strategic plan with a long-term vision to look at how we're going to renew our healthcare infrastructure. Okay, now I'm going to roll into a few slides on social determinants of health. And what that means is there are a number of social factors that actually affect people's level of health and the frequency with which they interact with the healthcare system. So this first figure shows you the top line that's going up substantially is actually the average incomes of the top 1% of Canadians from 1980 to 2010. And as you can see, in those 3 decades, the top 1% income earners, their income went up substantially. And this is based on Statistics Canada data, whereas this line here, which is essentially flat, is the average income for the bottom 90% of income earners in Canada. And so as you can see, over these 30 years, 90% of our population, their income, relatively speaking, didn't go up hardly at all, which is quite amazing. So this level of income inequality that's grown in our society over the last 30 years actually affects our health in a number of ways. And so this figure here shows the rate of hospitalization by income. And so as income goes up, people are hospitalized less. And what that means is people of low or medium income are actually getting sick or interacting with the healthcare system more frequently than people in the upper quintile. So that's the upper 20% of income earners in Alberta. And this is for 2011. This is the same idea. It's hospitalization rate, but in this case for self-injury. And as you can see, people in the bottom 20% of income earners in Alberta actually go into the hospital system about twice as often because of self-injury as people in the top 20% of income earners. So the point of these charts is that income inequality actually affects healthcare in a substantial way. It's one of the main social determinants of health, in fact. And so based on the research I've done, I've made a few conclusions and recommendations to end the presentation. And so one of them is, if we have the political will, Medicare is actually more than sustainable in Alberta. In fact, we could be spending more money on it for public health care should we choose to do so. Of course, that would mean that we would need to bring in a reasonable level of public revenue to the province, and as the new NDP government has indicated, they're taking certain measures to start to make that happen. As we talked about earlier, we need a national pharmacare plan. This is the website, pharmacare2020.ca. If you want more details on that, you can certainly check it out. It's a great website. As I said earlier, we need an honest assessment of our healthcare infrastructure. This is incredibly worrying for me, because right now we're already having a debate about the sustainability of our public healthcare services. Yet we also have this thing in the background of needing to renew our infrastructure, not only maintaining what we currently have, but also building new facilities. And that is going to cost a number of billions of dollars that we need to generate. And currently it's actually cheap to borrow money. So under the Prentice 2015 budget that didn't ultimately get passed, Premier Prentice was going to borrow, I forget the exact number of billions of dollars, to start to roll out a new infrastructure plan. And I believe we're going to see a similar sort of idea in Minister Sessy's budget in October, or I certainly hope so. Also, the NDP has indicated that we're going to start to have a infrastructure sunshine list, which would mean that based on actual need and priority, those are the sorts of criteria that are going to affect what infrastructure we build, as opposed to pandering to certain interest groups or other people who have influenced past governments into building infrastructure that was not at the top of the priority list. It's my opinion, based on the research I've done, that we need to start having an honest conversation about the number of hospitals we have in Alberta. And as we look at a long-term plan for renewing our infrastructure, what makes sense as far as the number of hospitals, where they should be located, is there other sorts of facilities that could provide the same level of public Medicare to rural constituencies who are seeing their older hospitals going into disrepair at the current moment. A point on the social determinants of health is, if we raise the minimum wage, as the government is planning to do, reduce income inequality, it's actually going to reduce healthcare costs for everyone in the province. And also, if we reduce income inequality, people are going to be interacting with the healthcare system less, which means it's going to cost us less to actually run that system. So income inequality is directly related to the amount of money we need to spend on Medicare. Lastly, based on a report we published in March of this year, we came to learn that Alberta has a long way to go to deal with our gender gaps and other discrimination in our province having to do with race and Indigenous heritage. And so those characteristics, gender, race, and Indigenous heritage, actually have massive implications for the amount of income people are able to earn in our province, which again is going to affect those specific people's healthcare needs and the amount that they interact with healthcare in our province. One of the things that Parkland is going to be working on in the next year or so, and hopefully some of you will as well, is advocating or doing research on the idea of having pay equity legislation. So we can deal with some of these sexual and race-based discriminations in our province. So that's my presentation. Thank you very much. So this is how you can get a hold of me by email. This is our website. If you have Facebook and Twitter, you can certainly follow us on there, and I certainly welcome any questions or comments you have. Like I said, we will be doing research on health privatization in the coming year. So we're now at the moment of doing background research on that and gathering ideas that might affect what we actually do as a research program.